our next part, which is a very interesting panel on autism. And we have some very esteemed speakers, panelists from across the country. Let me start introducing them. So we have 5 panelists joining us. So I have Dr. Praveen Saxena, a very warm welcome, sir. Dr. Saxena has over 20 years of experience in using latest advances in complementary and integrative medicine to address chronic health condition. His work in the field of autism and vaccine safety is highly commendable. So we look forward to hearing some very interesting insights on autism and vaccine safety today. Our second panelist, Dr. Deepak Gupta. He is one of the well-known child and adolescent psychiatrists in India. He specializes in dealing with children on the spectrum, ADHD, emotional behavioral difficulties, trauma, etc. He's the founder and director of Center for Child and Adolescent Wellbeing. It's a multi-speciality health clinic in Delhi. A very warm welcome, sir. Our third panelist is Dr. Arvind Bagade. He is a functional medicine practitioner with an MD in Ayurvedic medicine and diploma in nutrition and dietetics. He's a member of IFM. His area of specialization is neurodevelopmental issues and autoimmune conditions. He heads the Department of Health and Nutrition at Doman International Institute, Philadelphia, and #Ayur Wellness. He integrates beautifully functional medicine, Ayurveda, and functional nutrition when it comes to really offering health solutions to his parents. A very warm welcome, Dr. Arvind. Our fourth panelist is Dr. Chandrashekhar. He is director of Providence Microbiome Research Center and principal investigator of fecal microbiota transfer therapy for autism. It's a clinical trial going on. He strongly believes fecal microbiota transfer therapy can improve quality of life in autism. And not only this, administration of NAC in antenatal program may even prevent autism. Dr. Chandrashekhar, we look forward to hearing some very interesting insights on this topic from you today. Thank you. Our fifth panelist is Mini Dwivedi Gopinathan. She is a relationship development intervention consultant. We had a very interesting talk from her yesterday. She strongly advocates family-based behavioral treatment, which addresses the core symptoms of autism. She has a child with autism, which inspired her to start her journey to help other parents who have child on the spectrum. A very warm welcome again, Miniji. So we are very excited to have all of you on this panel, and I'll hand over to Dr. Ashwani to lead this panel ahead.
So thank you so much, Dr. Deepak, Dr. Praveen, Dr. Arvind, Aminiji, Dr. Chandrashekhar. I'm very, very glad and very, very happy that, I'll be asking you questions and probably I'll learn a lot of things. And of course, our audience, our doctors on the audience will learn, and probably, we can path a much healthier way for these kids. Of course, we're already doing a lot of work in the path. Probably if we learn from you, we'll also improve our own perspectives to it. So thank you so much, and welcome to all of you. So I'm a little nervous. So the senior doctors. Okay, so thank you so much. So I think I will just ask the question generally are asked by the parents. So one of the question is, when I tell them it is a solvable problem, it can happen if you work hard, then they think where is this guy coming from? He doesn't even know what is our problem. So I will go to each of the speakers. Probably I'll give you enough time, 3-4 minutes. With your own experience, with your own clinical practice, you have helped a lot of families and kids. So your own perspective, what is the reason behind the increasing problem? And what is your, understanding what is causing the problem, and what is the way forward for parents and kids? So I'll come to Dr. Deepak first. So Deepak sir, if you can take your time for 4-5 minutes and just elaborate for parents in a simple language. So what is the issue and how it can be tackled?
See, first of all, thank you to IFM, and thank you, Dr. Ashwani.
Sir, we cannot hear you.
Can you hear me?
So could you please remove the background IAFM, the banner, please? Could you please do that?
I don't have any banner. I have not put
Sir,
any
I think your voice.
I don't know.
Yes, sir.
Can you hear me now?
Yes.
Yeah.
Yes.
Is it clear?
Yes, sir. Yes, Deepak.
Yeah. So I think it was, yeah. See, what I'll say a few things is that one is that why autism is on the rise. I think that is one of the question is that, and is autism still a mystery disorder? That's another question. So let me tell you, we don't have any clear, simple answer to it. We don't have any clear, simple answer. But one thing is very clear: autism is on the rise, no doubt. To almost 1 in 50, which has come almost out of 100 kids, two out of 100 kids have autism, which is absolutely clear now that the autism is on the rise. According to me and according to various research papers which is coming up, still the mainstream doctors may or may not believe it. There's various, and as you've already mentioned in your epigenetic presentation, there are multiple epigenetic processes are there, which has increased the incidence of autism. And there is no second thought, whether it's an air, whether it's a dietary factors are there. We know the quality of dietary food, what we take today, it has reduced drastically. And there's enough papers are there, enough agriculture papers are there, which says it has drastically reduced from 30-40% what we take inside. That's one thing. So the quality, the food, which impacts us, that's the one strong factor is there. Along with the diet, the stress we are living into it, impacting a cell and various cellular process, that is another factor which has really impacted us. Along with it. And then one that stress factor, then diet factor comes out, it leads to a cascade of reactions, whether it's an inflammation, the gut inflammation, leaky gut, brain inflammation, oxidative stress, neuronal overload, all the glial process, everything it comes to, and that leads to it. So that I believe one of the major important factor is the dietary factor, along with the lifestyle. Along with that, we are exposed to the enormous amount of heavy metals, whether we are inside the house, outside the house, inside the house, from a kitchen, from a washrooms, from a bathrooms, the things we are using, the things we are exposed to it, along with the pollution, air pollution, everywhere we are exposed to the pollutants, everywhere exposed to the heavy metals. So it all adds to that. And the fourth important factor, which I feel is the electromagnetic radiations. I strongly believe that is one of the important factor which has led to the steep increase in the last 25 years, since 1995 to 2022, 27 years, as we have gone up to 2G, 3G, 4G, 5G, and as there is so much of radiation thing is there, so much of Wi-Fi connectivity, so much of exposures are there. I think that is also one of the reasons why which we have seen it. So all these factors have led to various imbalances in our body. And that is why I feel one of the major reasons. And these epigenetic process, as you said, that yes, they're identifiable, they're rectifiable, they are treatable. And if, unfortunately, the mainstream fraternity is still reluctant to identify. I am a child psychiatrist, and I work with so many mainstream doctors and so many people. I try to present wherever I get an opportunity to present my work. I don't miss any chance to present my work, to interact with my colleagues. They accept it, but they don't put it into action, they don't practice. So I think somewhere the reluctance is coming, is there. So all these multiple factors, I think, has contributed to steep rise in your thing. And this has lead to various processes, what we talk about, oxidative stress, inflammation, all these things, a lot to everything, and the cascade of reactions which leads to it. So this is one of my point put forward, as you've given me the opening chance. Thank you very much. And I feel that if we are able to identify step by step, see, it is not like 100-meter dash. I know some of the police, but it is not a 100-meter dash. It's a marathon. I have a very senior colleague of mine, Dr. Praveen Saxena, sitting here with me. I've interacted with him once or twice sometimes, but it is a marathon. You identify one part, you work on it, second part, third part, you work it, you look in a holistic perspective, and you see, and then you see it is not, and and best to best experts across the country, it takes sometimes some few years to work on that whole process. That's what. Thank you very much.
Thank you, Dr. Deepak. Thank you so much for your insights. I think that will give a lot of parents the hope that there are known triggers which is causing the problem, and there are ways to fix at least those triggers we can fix. So I come to Dr. Praveen now. So, sir, you have been one of the pioneer into this in the path for us. So if you can take your 5 minutes and help parents and us to know what is causing it and what is the way forward to us.
Perfect. At the outset, I'd like to thank IFM, and you people are doing a commendable job here. And Deepak, always it's a pleasure talking to you as well as working on some kind of concepts and all that. The thing is, I'd just like to begin with some things which probably we have to start thinking what has happened. Ashwani, I think we have all go back. We need to go back to 1991 when in California they started something like hepatitis B vaccine. And from 1991 to 1993, I'm just talking about the perspective why this is increased. So by 1993, there was a surge actually. There were 1 in 123 or something like that. 1 in 160 was the figures which was quoted. And they were able to see there's a steep rise in autism. What happened was later in 1999, IOM and as well as AAP, and there was one more body, they started thinking what must be the cause, and they saw there is something wrong, there is sudden increased spurt in autism and all that, and they came to a conclusion, and I have all the kind of data available. They said probably this hepatitis B vaccine what we are giving and the contents which we have got, which was something like thimerosal. Thimerosal was used since so many years, 1940 they started using. The thing is, I just want to tell you one thing. There are so many 100 kids are taking vaccine. Why only my kid is getting into that? We need to work on that particular thing. And what is that biologically different? What your kid is biologically different. I can always tell you, Ashwini, getting MBBS in 1990 with a kind of best school in medicine with a good rank, completing radiology, nothing has challenged more to me than autism, because this is a multi-system disorder, man. You were absolutely correct. If my examiners would have been there, we used to talk about if you know something in diabetes, you have passed the exam. That was the kind of time in 1990 we used to think about diabetes and metabolic diseases. My seniors, they used to think about tuberculosis or something like syphilis and all that. That was the kind of thing. Now a kind of person who wants to get his MBBS, he has to understand what is autism. This is a rather complex disease. At the same time, everything has been added by both of you. Deepak has elaborated fantastic kind of thing. I just want to, we have serotonin defect, we have something like sulfation defect, we have dopamine defect, we have got melatonin defect. The thing is, there is a big kind of, see, this is an orchestra. And one thing, if a tabla player goes wrong, everything music goes into a shambles. When you go into concert, you can understand. It has to be interplay between all these things. You have elevated ammonia, you have purine disorders, you have perfusion deficits. Only thing what I believe is the increase is because of multifactorial, but there is a triggers actually. I think you have been always talking about these epigenetic triggers and all. And this is one thing which we always try to work on. Having worked with my own kid, having worked with so many cases, I had given to the previous health minister, ex-health minister, 800 patients data where I showed this was the picture pre and that was the picture post. And the variables which was there was only that stupid vaccination, which was a combined vaccine. There are so many things. There must be some kind of, there are a subset of people, pregnant women who has got hypothyroid, pregnant woman who has got some other autoimmune problems. They are more susceptible to have kids who can or cannot be autism. But this is a fact. This is stark reality which is facing us, and it is high time. There was something like, I will just go back to one thing some time back, Ashwini. We thought Alexander Fleming has done an amazing thing by discovering penicillin, and it was such a wonder drug. Everyone used to be pushed with penicillin. And you know what? After 5 years down the lane, doctors like us, they started telling, no, there is something with the penicillin, and it was causing some anaphylaxis and all that. No media reported, nothing was happened. Later on, after the results of anaphylaxis, kind of this one, they started talking about giving a test dose of penicillin and giving that kind of thing. So the problem is all size, one fits for all, doesn't happen in all these things actually. The children who are born to autoimmune issues with the mother, autoimmune issues is such a wide thing. You are absolutely correct, Dr. Deepak, the kind of things what we are living with the Wi-Fi and all that. I have made a kind of thing. My clinic is totally Wi-Fi free. And I try to set by example. And I think this is a very tough question. At the same time, there are different people who are telling, okay, this was there, it was not diagnosed. But I had seen some of my seniors worked with some of the big doctors. Their clinical acumen was so good, they could not have missed autism in that era. There was no autism in India. I can always tell you, I have never seen a child. It was before 1990s. We don't have autism in India. It was only after 2000, maybe we picked up quite late, but somehow there was a minuscule number of cases. And somehow I have a strong feeling that something was not done. Deepak, both of you are on the same page, telling about mercury and other stuffs and all that, aluminum, whatever is it. But the thing was, what hurts us was the kind of the kind of investigation which was done. It was an investigation was done by working on something like pricking mercury or lead in the blood, which normally doesn't happen. It's a basically acute problem. If you have got a mercury intoxication by vaccine or by a sewage or any other stuff, you may hardly see for 24 or 48 hours. And you just do it after 2 years and say, oh, all is fine. And this is something which has to be, I feel all the clinicians as well as the parents, I see a lot of parents who are definitely, they want to work hand in hand. They want to, these people have to be informed about this. And it's like I said, it's a marathon and all that, but I can always tell you, yeah, there is nothing on the earth. You are motivated. You have an intent to help the child. Nothing can stop you. And yes, this is slightly a problem, okay, but I can always tell you, all the parents start doing it. Really it is overwhelming. As a doctor, I felt it was such a overwhelming information. I went to different places. I felt it was not easy to pick up all the threads. And here we need to follow our gut instincts and all that. I don't understand why this new generation parents, they are not understanding about Wi-Fi and all that. This has to be see, everything adds to the kind of immune instability. This is something which has to be always worked out. The kind of foods we never had this kind of foods, Ashwini, before. All this ready things and all that. But I see there is a persistent effect with all these things, and you need to be something to the parents, that don't repeat the mistakes what you have done before. And we had categorically, my second son is doing medicine first year, he will be completing now. And at that time, my relatives, my other doctors and all that said, "Arey, what are you doing?" In the sense, they were very sure. They used to, when he used to go, my second son used to go to school along with the elder kid, they used to ask whether this guy is normal. That is the way society behaves that. But I can always tell you, there are do's and don'ts, and you need to work it out. Yes, it cannot be 100% rectified, but I feel so happy. God has been kind on me now that my son has completed his hotel management. But at the same time, what I believe is, it has opened up some different thing. I started integrative medicine. I started working on looking at all the spectrum. We start with the gut. What I was trained in autism, what I was told about that, I try to apply into other things also. And I'm making at least difference to some people who are following me. That gives me a great good sleep. I don't need melatonin still, and I don't need any anxiolytics and all that. Anything else I could always tell, but definitely this is a problem, and we can face this problem collectively. And it's good that you people have come together. Or perfect. Yeah, I think Ashwini, my time is almost 4 minutes, I think.
Thank you, sir. Thank you so much. I think your personal journey, and probably sometimes we're all directed to some direction, whether
I think it's a divine thing.
Yes. Yeah. So I think all of us are learning, and at the end of the day, I believe if we as a human race willing to make an effort and do it, things will happen. We don't have to look for answers. Answers are given to us. So
mostly, see, we had seen only regressive autism here in the present. and
Yes.
telling that, okay, it's congenital and all that, this is all rubbish here. We understand there are some things and all that, but all predispositions should not be a kind of thing. If you would have got something, you should have get schizophrenia sometime 40 years later, not at that early age here. So something is inducing some things actually. We need to look at that.
So that's a good concluding, that it is not the nature that is a problem, it is us that is a problem, and certainly we can fix our own problem. So I come to Dr. Chandra now. So, you also has a personal story behind it. You yourself, a cardiologist, turned into a fecal transplant expert. So, sir, if you can help us understand, and probably the parents and the clinicians, what has led you to the story, and then what is your understanding so far?
Yeah. First of all, I would like to thank IAFM and Dr. Ashwani sir. You have been great support for me. So I have a child with autism, you know that, and she had a lot of gut issues, and which was never resolved with medications. So we went for a fecal transplant, which relieved her gut symptoms. At the same time, she was developing she was developing neurologically also. She was getting neurological benefits. So when we looked into it, and I did some extensive research, so we understood that this is happening inside the womb itself. So the autism is happening inside the womb itself. It is like the child is, there is a brain developmental abnormalities are happening inside the womb. I started looking into the autopsy studies. When I started looking into the autopsy studies, I understood that there are certain brain areas that are not properly formed. And this is happening, and the new advancements, recent advancements in the next generation sequencing and all, they figured out that autism is epigenetic disorder. And you rightly said that it is body disorder, like it is not so only brain disorder. And I happen to understand that there are 1800 mechanisms that are affected in the brain, and 5000 mechanisms are affected all over the body. So, and so one more important finding I understood is that global developmental delay is it is just like autism plus something like underdevelopment in the motor cortex also. So this is like it is affecting entirely the neurodevelopment inside the womb, and this is happening because of the epigenetic errors. Epigenetics is just that gene environment interaction. So I tried to look into the microenvironment in the mothers, like what's happening in the world. So I happened to read about the toxins in the pregnancy. There was one study that happened in the 2007. This is done by Environmental Protection Agency, USA. It's a government organization. They did like the study of the umbilical cord blood. In that umbilical cord blood, they were able to identify 232 toxins. Mostly they were pesticides, weedicides, and industrial toxins, and microplastics. And by this time, this is in 2007. Now it is 2022. Probably it will be 1,000 toxins now. And you can also observe the autism cases 20 years back and now. Not only the number is increasing, the severity is also increasing. So, so when I try to look into the deeper aspects and all, I understood that there is something going wrong in the womb itself. We are working on umbilical cord blood and meconium studies to understand the uterine environment that is causing the problem. What I believe is like whatever we are drinking, whatever we are eating, whatever we are inhaling, so we are transferring that to the developing baby. So that is interfering with the structural development and function of the fetus. This is the actual cause of autism. So I see autism into two parts. Like one is possibly a genetics, and another is epigenetics. So if it is entirely because of the genetics, like the number should be proportional to the population rise. But it is not so. It is not it is disproportionate, and it is rising very faster. And when we when we tried fecal transplants in kids, they were improving. They were improving neurologically. So we understood that it is a large number. Also, we tried in around 40 children till now in last 2 years. It is like a pilot study, and some children in their trial. So we understood 80% of children, they were actually supposed to be born normal. Unfortunately, they lost their life. So once their brain development happened and in the womb, and when they already got neurological deficits because of the underdevelopment, so you may not recover them completely. But what we can do is like we can identify the factor that is causing the autism. So if you prevent that factor, that can prevent autism. What I feel is like if you do umbilical cord blood toxicology study and identify the toxins, and if you do the toxicology studies of the pregnant women, so then if somebody is susceptible genes and somebody has high pesticide load, high weedicide load, high industrial toxin load, you have to detox those mothers, pregnants, so that the child will get a toxin-free environment for the natural development. So that child will escape autism. This is my concept. We are working on that actually. So in the first phase, like we are doing a fecal transplant and seeing the changes in the epigenetics. So this is the first part, and the other part of this study is like we are looking into the meconium. We are looking into the umbilical cord blood, so that what we can do for the future for the prevention of autism. So I think that whatever the rise in numbers, it is because of the industrial toxins and environmental toxins, mainly pesticides and weedicides. Thank you.
So thank you so much, Dr. Chandra. I think that this makes a lot of sense that, you are creating the real data for even the medical industry or medical practitioners, that this is the problem. Let's not just ignore everybody that whatever we are saying, that there is a evidence which is causing, of course, it is most of the time, like you said, it's a regression happening later, yes, after 1 year, 1.5 years.
We have seen, sir, like they when they are exposed to the toxins, they get a susceptible microbiome, which will be shattered down with the vaccines and antibiotics. We have seen a child. She was like almost normal. She was diagnosed with vasculitis. The child came from Mumbai. She was diagnosed with vasculitis at the age of 2, and she was a normal child. So when they have given higher antibiotics for a longer period, the child lost the speech. So we tried fecal transplant for that child. The child regained her speech after 2 years. Now she's 4 years old, and she lost her speech at the age of 2. At the age of 4, she regained her speech. So it is not happening with other autism kids. It's because those areas are not developed. The Broca's area and all, they are not developed for the other kids. Whatever the developed part is there, that is getting functional after fecal transplant. So this child had entire brain development properly, but she lost her speech because of because she lost some microbiome, which is involved in the epigenetics. When there is derangement in the epigenetics, the child lost her speech because that Broca's area and Wernicke's area, whatever that speech areas and language areas, they became dysfunctional because of the epigenetic errors. When we did the fecal transplant for that child, those epigenetic errors got reversed and they started functioning better. So this was an example of the thing. So regressive autism is also because of this microbiome. So it is like, but we have seen considerably 30% of children not responding with fecal transplant. They did not have gut symptoms and they did not have food allergies. So most of the responders had gut symptoms and food allergies. So the rise in autism numbers is most probably, I think this is the modifiable factor. I think so, like microbiome, maybe the modifying factor. That is the biggest challenge now.
Right, sir. So I think great news for the parents that if regression has happened, that's what I keep telling them. If regression has come later in their life, there's a good possibility that recovery to a greater extent can be made. So I think that comes as a relief for parents also. Thank you so much. So I come to Dr. Arvind. He's a combination of functional medicine, modern medicine, and Ayurveda. So that's a bringing an old approach and a new approach. So and he also is a has been working with these kids. So Dr. Arvind, what is your findings and your understanding so far, and what would you tell parents?
Yeah. Thank you, Dr. Ashwani, for giving me an opportunity. Thank IAFM for making this happen. This is an amazing opportunity for both practitioners and parents to get together and learn a lot from all of you guys. So a lot has been said by the expert speakers before me. So I'm just going to share my personal experience. So my daughter was getting her first dose of DPT vaccine. First, then I realized that on the same day she started developing seizures. So I then discussed with the pediatrician, and he said, "Oh, maybe we can continue with acellular pertussis or something like that." And then I asked him, I'm not a big expert in the field of vaccines, but you are. Why don't you discuss with parents, the possibility of, these things? They said there is no evidence. So that's when I started exploring more and more about neurodevelopmental issues and the factors which we as healthcare professionals usually miss. So treating autism, ASD, and other conditions, I think it is more like peeling the layers of onion. So you start from one layer, can be gut health, the enzymes, microbiome, SIBO, CIFO, and stuff. Then you go deeper to, genetic levels and assessing whether there is a methylation effect. Because the problem in India is also with a blend of the tradition, the practices that we have, especially if I talk to a parent about eliminating dairy, it is, I think, the biggest battle that I'm, having with the parent, because they will say, we never had any problem with dairy. Why are you suggesting such a thing? What about calcium? The same discussions goes on and on. And I give them the example of how these countries who are the biggest consumers of dairy also have the highest amount of osteoporosis and stuff. So that is actually a myth that we all have in India. And, just imagine a child having an issue with, the methylation pathway. There is a problem in the trans-sulfuration pathway. There is a detox issue. How is the child going to even eliminate the toxins? We are getting this bioaccumulation of toxins from, seafoods, especially fish and stuff. Not just methyl mercury, but a lot of stuff. The fish eats a bigger fish and that eats a bigger fish. And there is this cumulative toxicity. How will that child detoxify the system? How is a child who is having severe gut issues, microbiome issues, there is inflammation, which is being, ignored for years and years. How is the child going to come out of it? So my approach and what I have seen, especially in India, is these layers or these different dimensions. So we'll start from one and then keep on moving, testing for infections, testing for inflammation, and testing for unaddressed latent infections that probably is not very common in India. Things like EBV and stuff, but they all had a great impact in terms of regression, in terms of intractable seizures and not responding to medications. And then the doctors just pushing more and more medications, 3, 4, 5 anti-epileptics. And then, without thinking that the child probably is trying to give us a hint that something is going on, try to find out. And if the same thing happens with a child with autism, they're just thinking that, oh, it may be behavioral, or, just CBT is everything, and there is no role of all these fancy tests. And so the other issue again is about the radiation exposure. We never had this amount of low costing, highly effective internet and stuff in India. And now parents, they have access to all of these stuff. So they have access to information, they have access to technology and mobility. So they just want to explore everything for their child. And we don't blame them, but we as healthcare professionals have a great responsibility to educate them where they have to get the information and what do you consider as a reliable source. That is more important, because I've seen parents coming to me with a diagnosis. Telling that I think that this is the problem. Can you help me in detoxifying heavy metals? So, unless you test, there can be copper zinc imbalance, there can be, loads of other things, not just heavy metals. So it is, a responsibility of both parents and healthcare professionals, and that they walk towards each other and consider this as a mission, as a journey, and not just prescribe something and say, well, this is what it is. So I think this is what my experience has been in the past 6 years, 6.5 years, where I've moved specifically from a general practice to a more focused neurodevelopmental approach, where I use aspects of nutrition and dietetics and aspects of Ayurvedic, detoxification and procedures like that, to help kids in different ways, both in terms of recovery and also in terms of weaning them from medications, and also help in promoting detoxification and stuff like that. Still a long journey ahead, but here we are.
So thank you so much, Dr. Arvind. I think at the end of the day, the gist of the story, what you're saying is there is again a reason it doesn't happen to isolation, and there are ways to fix it. And if a parent is willing to listen and do the right needful hard work, it's not easy. It's not easy. Dr. Praveen himself has gone through a journey. It's not easy. But if we are willing, yes, sir.
Ashwani, I just want to, I keep telling, I just want to add one thing. This is a red flag. Doc, Dr. Arvind, you had a child similar to Barbara Lou Fisher. She had it was a big thing what Barbara Lou Fisher has gone through it. But having a fit and all that, it's certainly a red flag. I have seen people after getting this also, they just go for that stupid shots and all that. What I want to tell you is, emphasize here is, if your child after a DPD shot had the redness over the skin also, had some fever, inconsolable crying, and you need to, these are the subset of kids who are going into problem, withhold all the vaccinations from that itself. That's a big red flag. I had it's basically we are trying to decipher that, and I urge all the parents to put across into all your groups, see that even there is a small thing. I had seen as a radiologist, I used to do neurosonograms, I used to work for a pediatric hospital, and the child who gets fades, the causes, you get MRI, you get something, nothing is found, and you need to ask for the history. 1 week back, 2 weeks back, they probably had this DPT and which caused it a problem. It is so horrible that acellular pertussis vaccine was not even talked among people. I gave you a kind of thing, Ashwani, because in 1999, this IOM and all that came up with a thing. Is a biological, it's a mercury which is plausible. So they removed every entire mercury from them. Chandrasekhar, we are talking about what may be the likely kind of things, insults which are suddenly causing this. But this particular thing, the moment you remove the mercury, you had added aluminum and all that. I think this is a very big thing. And really, Dr. Arvind, Dr. Deepak, I'm happy I have come and met you people. Certainly, we can take it forward. We need more modalities. We need Ayurveda. We need homeopathy. We need good functional medicine. We cannot just use a single straw and correct everything. We need a total approach. Thanks, Ashwani, for coming.
Thank you, sir. Thanks so much. So I think I'll come to now Mini Dwivedi ji. So she, from a software engineer, turned into a practitioner, which is helping children because of her own story. So all of us with a story. So I urge Mini ji to share her story, and then, what are the possibilities, what new techniques you deploy for these kids, because I see a lot of parents year and on keep doing therapies, but the very, very small gains. So what is missing there, and what are the new ways you are deploying to help these kids?
I will start with thanking you, Dr. Ashwani, for having me in the panel, and thanking you for organizing this conference, which is really going to be so valuable to so many parents out here. And it's my honor to be talking in between so many doctors, and I am really nervous. And I should not be dishonoring by saying something. And there's so many experts, Dr. Praveen, Dr. Deepak Gupta. Actually, I have met Dr. Deepak Gupta myself for my son long back, and you are there, and I've heard. So first thing, forgive me if I say something wrong, because I'm not a doctor by my education, but whatever you have said, something I completely believe in, biological basis. But then I'm not someone who can just go and start I mean, I cannot use it as my practice. I'm not a doctor. So being a mother myself, and I just wanted to, as Dr. Ashwani asked me to share my journey, when I myself became a mother of a child with autism and I had to quit my job and the entire plan of life got changed, I wanted to contribute to the society and community in some way. And then I had to find a path, and my journey started with like taking a small course in special education, and then starting a center, and then working with other people and other therapists, and going through that journey and learning stuff. And then when I come across that, oh, whatever we are doing, it used to stress my child. I observed a lot. Children were stressed. They were always resisting the therapies. Either they were controlling the parents, and parents were so scared that if I do this, the meltdown will happen. And if I don't give him a chocolate, the meltdown will happen. So if I want my child to do something or to comply or to learn a skill, I have to reinforce it. And I saw a lot of people using the chips and the chocolates to give as reinforcers to make those children do something, perform something when the instruction is given or when a therapy session is going on. Somehow that moment itself, when I saw my son going through all that, I felt very sad that day. When the day I came back home, and I was very sad that my son will say, therapist will ask something, do this, and my son will do this and then chip, some do this and chocolate. I was like, no, this is not natural. This is not authentic. This childhood is not authentic. And that's when I started looking into other areas that, okay, how can I bring back the authentic childhood of my child? Now, whatever happened has happened. I do believe in it. The vaccinations did the damage and autoimmunity did the damage. But then now what? And then I started seeing that in this entire process of having a child with a diagnosis in the family, how it affects the child and the parent is loss of guiding relationship. So because we start believing that now my child is disabled. And of course, my child has a disability. My child has a disorder, to be more precise. But we stop believing that now my child has a receptive language, or my child understands, or he himself also has a sense of his own individuality. And we kind of start forgetting it because, yes, my child is having difficulty in connecting to the environment and making sense of the environment and then perform. So what it changes us as parents, and we become very instructional, and we move away from the role of a guide to a role of a teacher. And that's where starts the stress response, where we teach them day and night. It's like, as I say, the moment we see a child, our teaching bit is on. And we completely lose the guiding relationship, a very unique relationship, which comes automatically. Automatically, it is there when a child is born, because our bond as a parent to our children is so unique. So we are able to provide a physical safety to them, but we are not able to provide a mental safety, and what we call as theory of secured attachment. That I do not feel safe because I do not feel competent. Because if you instruct me so many times in a day for every small thing, and I'm not able to do it, I lose my sense of self. I don't feel competent. And that is always increasing my cortisol, and basically I'm always in that stress response. And then I'm just my body is just trying to manage the stress response. Nowhere the learning is happening. So, and as Dr. Arvind mentioned, that the entire motor system is so affected. At the age of 2 months itself, because of the epigenetic factors, we do not see the same kind of motor movements in children with autism, what we see in typical development. So the inner core and the outer core is not developed. So the various rotations across the planes of the body, the sagittal plane, the transversal plane, the trunk rotation, it's not there. And which is the basis for all the motor, which is the foundation, the basis of motor foundation for all the skills we're looking for, speech or writing. And that entire motor underdevelopment affects my vision. I'm not able to process the sensory inputs coming from my outer world as well as interoception coming from my internal world. I do not know how to deal with my interoception. So the only way to help a child who's suffering through so much is through relationships. So if on the top of all these sufferings, if I am trying to make my child speak, a child is nonverbal, but I am bent upon that, no, my child has to speak. And I get so, I myself get so frustrated when my child is stimming, what we call as stimming, which is basically a self-soothing behavior. When my child needs to focus, my child needs to get hold of his own body. The body awareness is so poor, again, because of all the reasons which we have discussed so far. So you want me to do something, but I'm not feeling my body. I do not know. This whole experience of embodiment is so overwhelming for me. I'm getting the sensory overload from everywhere, from all the exteroception, all my exteroceptive senses, as well as my interoceptive senses. And on the top, you want me to talk. On the top, you want me to look at you. And I do not know what is this function of eye contact, because that's something I'm not registering, because I'm not connected to self. I'm not connected to the environment. So this all understanding started changing my own practice, itself. And I started exploring into relationship-based models, that how co-regulation can help my children. So my children, those are already suffering. And because of their wiring, their neurodiversity, they are already going through a developmental trauma. So how do I integrate trauma-informed practice with my children? First, soothe them, calm them, help them to feel their bodies, connect them to their bodies, connect them to themselves, and then help them to connect to the environment. And then perhaps comes the skill part. So this whole journey, so the kind of work I do, I create that path. I try to empower the parents to create that path for the children. And the whole the functional medicine work is very important. I mean, the integration of the functional medicine work and other work is very important with this. But this is also a very important piece, even if, because typical development also needs a caregiver who is a guide. Even if biologically I'm fit, and if I'm left in an orphanage where there is no one to hug me, no one to cuddle me, right? No one to, I still get a trauma-driven practice, a trauma-affected practice. Sorry, personality. So that trauma affects my personality, and I turn up to be a different kind of child, right? My personality style changes. I become a connection seeker or an avoider. So this role of relationship is very, very important, along with what functional medicine is doing.
Okay, thank you so much, Miniji. I think this is very, very important, because a lot of parents, they keep sending the kids for this therapy. The child is overwhelmed with, and then basically the gist of what you're saying is we cannot force these things or the skills on them. They should learn by themselves, from picking up from the environment. We should enable them to do that. And you as a mother or as a parent or a therapist, when you connect to them, their body would heal from within. Not that we can force them something from outside all the time, do this, speak, show me this, show me that, bring me this. So that's an interesting, very, very interesting, because the convention system is moving towards forcing things, but you're saying it should come from within, and all of us learn like that only. No, nobody forces us.
Because intrinsic motivation is such an important part of doing whatever we do.
Yes.
So a lot of parents, they say, oh, the things which my child likes to do, he does it very well. Yes, because he has an intrinsic motivation for that. For other things, the child is resisting. So how to create that intrinsic motivation? That can only come through relationships.
Ashwani,
Sorry, Dr. Praveen.
Yeah, sorry. One just caution. The only thing is the motivation is this cell phone also. Try to switch off your mobile data, put in the airplane mode, and give whatever you like. But I have seen parents who say, okay, this guy is addicted to the cell phone and all that. This is really something which is something, it's not in sync actually. The child tries to go like this, and whatever we do, I don't think we can help them out. But as you rightly said, this is a big kind of thing. As a parent, I have empathy. I'm trying to understand. I can understand what you are trying to tell out. Thing is slightly complex, and always these complex things require some simple solution, and there is no one single bullet shot which helps everything. But only thing is, what we believe is we need to not, as a parents, trying to understand what your doctor is trying to tell you. Try to work on that. Don't try to figure out what is the best shortcut. People are looking. You have seen the kind of yesterday's news, Ashwini. This court has come out heavily on the stem cell therapy.
Yes.
there is nothing wrong against that particular thing. The way it has been kind of thing is, I think this is a big thing, Mimi ji. I think it has to be taken with a kind of caution, and at the same time you need that. We don't see empathy in our doctors nowadays, and we believe certainly, because we don't have all the time in the world to be with the patient. So I think this is we as a parent, most of the parents to whom I have worked, they start taking the responsibility and starts working on that. It's a kind of always 2 steps forward and 1 step backward approach we try to. At the end of the day, you move. And yes, it's a very aptly put your kind of stuff, and definitely I make a note. And the only thing I thought I should tell you, this is one of the things should not be
Yes.
given as a
Yes. So whenever I ask parents, okay, interact with your child, but you do not have to bring iPad or phone into the picture. Interact with through bodies, through rhymes, through play, through music, or anything else, through cooking, through household chores, or whatever it is, books. But no cell phone, no iPad.
Fantastic. So I come back to Deepak with a little tougher question, which is the vaccines. So Dr. Praveen talked about, Dr. Arvind has talked about. So in my practice, also a lot of parents says, my child has taken mRNA vaccine, MMR vaccine, and then after the regression has started. But then, they say, shall we give more vaccines again? The schedule pending for them. So what is your experience with that? What?
See, I have a very clear advice. I tell them very clearly, you yourself have witnessed a vaccine injury. If you have witnessed the vaccine injury, why you want me to validate? If you have seen a vaccine injury yourself, then respect that. But yes, there is a very, very, very strong pressure from the very other medical community, fraternity, and the school, and even the government now. They got a circular that you have to get this. I say, fine, please buy time, at least till the 5 years of age, minimum. And still, if you get pressurized to put it, only put single vaccine one at a time with a big gaps in between. And during this time, when you're taking, make sure your methylation support, your antioxidant support, your detox support is in place. So that is my recommendation. In the end, a lot of time it becomes very difficult for them to follow it sometimes. But that is what I recommend strongly. And they even ask for my second child, that my first child, because they would have come to me when the child would have been 4 years or 5 years, and they already would have a child which is 1 year with them. And they tell me that with my first child, it happened. Dr. Gupta, I have already given to the child the first 3 months, 6 months. Shall I give the 9-month vaccine or not? So these are very difficult questions. So I tell them, if you can avoid, please avoid till the age of 3 years minimum, because that is the time maximum regression happens. It does not mean regression cannot happen at 4 years or 5 years. It can happen. And we are seeing more and more, as Dr. Praveen said, now out of 10 cases, we see at least 9 cases of regressive autism. When I started in 2004, I came back from London. Out of 10 cases, I was seeing 4 or 5 cases of regressive. Now almost 9 to 10 cases of regressive autism. I really try to find out which one is not regressive autism. In fact, that is where I see. And if the parents deny, when I take a careful history, I find out that this was also there. It may not be only language regression. It can be a social regression. It can be a motor regression. It can be a combination of social, language, and motor regression. All three can be there. So there can be different permutations. So this is what I recommend to the parents about the vaccines. And I'm very clear. I tell them, I believe it. You want to believe it, you believe it. Other fraternity may not believe it. But if you believe it, and if they please follow it. And vaccine injury is a very controversial topic. I do also tell them, because sitting in a place like Delhi, which everything is available on the Google Touch, so much things are there. I'm very clearly. I said, and they also asked me, also one more question. If you would have been in my place, would you have done it? I said, yes, I would have avoided. If it would have been only in my control, I definitely would have said, no, don't go for the vaccine.
So that's a great relief, I think, for me also. I keep telling them with this, but a senior doctor saying that, so I will also start with more aggression that, this is.
But one more thing is there. A lot of time there is that one thing which they ask me, that there's so many millions and millions of people are getting vaccination.
Yes.
They don't get it. Why only subset of population, which previous colleagues were also talking about? That's what. So this particular subset of population who is vulnerable, and they get it. And till today, we are struggling to get those biomarkers which we can identify, in pregnancy or early first year or early few months. We can say, okay, these kids are prone, so absolutely no for them, which we don't have. So we don't know what that adjuvant, which is aluminum, which previously mercury, now aluminum and other things, which one will cross-react with the genes and lead to coming of autism. We don't know. So that's why it becomes very, very difficult. And with so much of propaganda, so much of media involved in vaccinations, so much of vaccination programs involved, so much of billions of industry, billions and billions of money involved in industries, it becomes difficult for a common man to take a clear-cut decision. Should I avoid vaccination or not?
Thank you, sir. I think that's very, very clear, loud and clear. And then it's up to the parents to understand and take a right decision. We as a practitioners, we can only guide, we can only tell the facts. But at the end of the day, this is their decision, and they should be more aware. As a healthcare consumer, we should be also aware, what is wrong and what right decision. So that's great. So Dr. Praveen, when vaccines were not there, fairly apart from the, we were hungry and dying at early age was a reality. But otherwise, I'm from Punjab, and we have seen a healthiest population. And today, Punjab is a place where a lot of cancer, a lot of diabetes, a lot of cardiovascular disease, and kids are having problems. And in this last 20-30 years, number of vaccines are increasing. So are vaccines adding any benefit to us, or it just counterproductive? So what is your research says?
It's not the research, I think, Ashwini. I think we need to go back to basics. One thing which has improved less number of infections are probably better sanitation and good water. This is something which there is a kind of debate, but we can always I can always go back to the metropolitan 1945 studies also, which effectively showed the decreased number of these things are because of a better sanitation, better plumbing. That was the kind of keyword. At the same time, we are talking about a subset of population getting involved. I think it's a high time we need to define what is this subset of population we are talking about, because every other thing, there are two in the family, you have got two cousins and one cousin behaves totally different the other person. That's the problem with the medicine, because two things cannot go hand in hand on the same kind of thing. So like something by which we try to work it out, a mother with high lymphocyte count, mother who has got something like high antibodies to thyroid, may not be she's hypothyroid also. But these are the markers. With the advent of this pandemic, now we start looking at something called HSCRP. And once we are sure this guy or she has got a high CRP, most of the time they have something which is called autoimmunity. And we need to pick up this subset of population and try to work on that. And because yes, the technologies to this one, I don't think we can get away without using our cell phones and all that. At the same time, I just want to add one more thing, which is a big kind of thing. Stephen Sinaf told me about that. You can always go into the work actually. This is glyphosate. For God's sake, try to get into something like organic farming and all that. Try to encourage that particular thing. Though, because what I have seen in India is it's a tough thing. Everything is glyphosate. And glyphosate, Chandrasekhar, you should also agree about that. Totally disrupting the microbiome, man. So there are things at stake. I think big things. There were interesting questions and answers are coming up. And I can always tell you, we tried covering up this thing in something. Anything else, Ashwani, you wants me to talk?
So I think
need to go.
Okay, sir. So just we have half an hour more. If you can be with us, or
Yeah.
Thank you. So I think, what Dr. Saxena said, there are basic markers. They're not fixed markers, very definite markers, like Dr. Deepak said, but they're basic markers of inflammation, of autoimmunity, CRP, hsCRP, ESR, lymphocytes, eosinophils. If child is not in a healthy situation, healthy condition, probably then try to postpone some of the vaccines till the time your body will be in a place to handle that, so that, less injury done by them. Now we'll just move from the problem to the solution. So, Dr. Chandrasekhar, what is your experience? What can be expected if a child has a problem at a younger age of 3 years, 4 years, comes to you? For how long they have to do this, microbiota transplant, and what are the rates of expectations in terms of recovery if a child already has normally born and regressed later in their life?
So most of the regressive autism cases, you can see they have. I think I didn't have a autism practice, and I didn't see so many cases. But in these 30-40 cases we have dealt, like most of the regressive autism kids had some sort of gut issues. So that is where I was thinking about the susceptible microbiome. But when the studies were done on the microbiome studies. And the microbiome studies said that this is a phylogenetically a different ecosystem. This has capability of immune dysregulation. There are certain gene modules they have seen they are behaving differently. That's why they are reacting differently to the vaccine. And any trigger, they have a different immune responses. In my child case also, she had nephrotic syndrome. She had 6 episodes of nephrotic syndrome, and it's a minimal change nephropathy. It's immune mediated, and steroid is the only treatment for that one. And she was not able to cope up with that condition. She was unable. She was almost becoming steroid resistant. But after fecal transplant, we were able to stop that nephrotic syndrome as well. Just like it is like immune dysregulation. They have an immune dysregulation. Their gene modules are undergoing some sort of epigenetic errors. We have tested her genetics for that one, nephrotic syndrome. We have found one important nephrotic syndrome kind of gene having undergoing differential alternative splicing events. It is like differential alternative. She had heterozygous mutation for the nitric oxide synthase adapter protein. This is very much important in some immune regulation in the nephrotic syndrome. So one gene was abnormal and one gene was normal. The normal gene was undergoing differential alternative splicing event, that is producing nephrotic syndrome, that is causing the nephrotic syndrome. When we did the fecal transplant, the differential alternative splicing was recovered, and she stopped getting that nephrotic syndrome. So by using like microbiota transfer therapy, we can actually alter their epigenetics. And we have done some studies also on 14 children. We have blinded it to the investigators in the National Genomics Corps. It's a government organization. So we have given 4 healthy children blood samples, and 10 autistic children blood samples. And we have given certain genes undergoing differential alternative splicing events. It was already proved earlier in the one small study. So when we have given the differential alternative splicing events were like, we were shocked to see that like all the 4 neurotypicals are clustered at one place, and all the 10 autistic kids were clustered at another place. That is now we are working on a serum marker for that concept. And so now there we have given 60 genes. We are working on a most sensitive and specific marker for that. This epigenetic marker can be like we can see some. In my child's case, it was nitric oxide synthase adapter protein, and some other kids may have. So we have to do a large scale study for this one, and we have to find most sensitive and specific marker for autism. So if we can do that. If you are successful in figuring out most sensitive and specific marker, which undergoes differential alternative splicing consistently in all the autistic kids, that will identify the child on day 1. So when the child is identified on day 1, you can decide about the whatever the epigenetic factors like vaccines, antibiotics, and food, pesticides, and everything. You can cut down all the. You can prevent all those epigenetic factors. This model, our work may help in the future for this one. So which child can go for vaccine, which child should not go for vaccines, and we are also working on something like this, whether vaccines have role on this epigenetics or not, whether they are they are impairing the immune gene modules and all. So probably if we may come across this one also. Now we are also studying whether MMR is causing this immune dysregulation. Like in my child case, it was so the thing the nitric oxide synthase adapter protein alternative splicing, differential alternative splicing was reversed. So whether we are seeing that we'll be doing some test like before MMR vaccine and after MMR vaccine and see whether this is causing this kind of differential alternative splicing in the genes. So if we prove that, then that, it is like proving one factor for that. Whatever if at all MMR is causing that kind of thing, we can always prevent so many autism cases. So it is like you can prevent vaccine injuries. So this is we are working on this one. So it is like MMR. It will be like me working on MMR and immune dysregulation will be it imposes a lot of threats on me, but still fine. We will do a small study and publish, and we'll try our best to go for the whichever the possibilities after the studies.
Fantastic, Doctor. I think this is good to set the path for, just like Dr. Deepak has mentioned, there are not fixed markers. Probably you will come us with for the parents to decide and to guide them better. And of course, one other very important aspect you touch upon is the microbiome in the gut is sort of driver for the immune system. If immune system is bad, inflammation is there's a microbiome which is behind it. And if we deal with the microbiome in a better way, we remodulate it, make it better, the immune system gets better and self-damage stops. Of course, we'll have more speakers on. So thank you so much for this key message and your work and research to come up with new markers. So that's great. So Arvind, I will come to you. So what is the general path for a parent? Parent comes to you, then what all you does, and what are the different things that as a tool that you use for a parents, and for how long they have to do to ensure that recovery is made. So if you can elaborate on your way of practice.
Yeah, so basically I'll start with gut, because that is the driver for health and disease. So I'll start with gut function testing based on the symptoms, and see how the microbiome is, how the enzyme levels are, and whether there are nutritional deficiencies to address, that there is bacterial fungal overgrowth, or there is dysbiosis and all those stuff. And then probably some of the expressions of the child, which we call symptoms, is basically a way of the child expressing what is going on. So keeping that as some cues, I'll try to find out what the child is probably telling us, and how we can use it as a tool to understand what's going on. And based on the results, I'll start my first level of gut healing. And then the second level will be to know about toxins. So we'll do something like a element analysis, or heavy metal load and stuff. And it was interesting for me to, when I first did the hair element analysis, it was found that there were high levels of arsenic, lead and stuff in my child. And later when I did more and more, and we had like data of 100 to 150 children in India, it was found that it's basically rice, especially in South India, which is very staple and mostly contaminated. And especially in kids who have an impaired detox pathways, they tend to load and store these things and causing issues. So the second layer would be to think of what else is causing like toxins and stuff, and then it would be the methylation status and infections, and probably that would be the pyramid that you use, along with educating the parents as to how they need to think or view this as a sensory processing issue, and not just a behavior of the child. It's not the child to be blamed for a particular behavior. It is a way of the child tuning out hypo or hypersensitive responses. The child is just stimulating just to find a way to come out of the chaotic environment outside. So it is both educating the parent and also working on the child. That's how, and probably it would take a good 6 to 8 months to see some noticeable changes in the child, which is sustainable. Because as soon as the parents start giving some supplements, the parents are like, oh, my child is feeling a lot better, my child is sleeping. But it's not just everything, it is just the beginning. There is a bigger picture we need to address, and to go there we have to go layer by layer. And some parents drop out because they don't have the patience. As you said rightly, they want a single shot which goes through everything, and that is not always possible. I wish it was the case. But yeah, with a good number of tests available in India and also outsourcing, we are able to educate the parents and achieve a good outcome in most of the children. But I do think there is a question which parents usually ask me, which probably Dr. Chandrashekhar would be the right person. High concentration of orally given probiotics as opposed to fecal microbial transplant. How is that weighed as what is the best and long lasting? So I think that would be a question back to him if time permits.
Yeah, yes. So we have seen that. So along with microbiota transplant therapy, we try to give 2 probiotics. One is Lactobacillus reuteri, that is from breast milk. And we have seen that when we give Lactobacillus reuteri to the people with live bacteria, their sleep is better, their mood is better. Probably it has some role with the serotonin and all, I don't know, but we have observed. So in my child also, I have observed whenever we give Lactobacillus reuteri, it was the child was getting better. So we also use another controversial, but it's I feel it is very much needed in the neurodevelopment. It's Clostridium butyricum bacteria. It is Clostridium butyricum bacteria. We don't have probiotic in India. We get it from Japan. So we tested for the newborn children also for its presence. So we have tested 2 to 3 children for microbiome studies. They have 18 to 20% of Clostridium butyricum in their gut. Yeah, like we are studying in the meconium also. So when my child was diagnosed she was suffering with nephrotic syndrome. I happened to read some Japanese studies saying that butyric acid producing bacteria are less in nephrotic syndrome. So I was searching for some probiotic which can produce butyric acid. So I found this one. I bought it from Japan, and when I used it for that my child. So my child was not even having gross motor imitation also. She was not even recognizing us at that point of time. So she started gross motor imitation after 2 months of usage of the Clostridium butyricum probiotic. So I would rather suggest so we have to be very careful. So which probiotic we have to use, and otherwise it can backfire sometimes. So I feel these 2 probiotics have direct role in neurodevelopment and direct brain health. So these 2 probiotics I'm giving it to every child, even after the fecal transplant, we are suggesting them to take it. But somehow this Clostridium butyricum probiotic, like few kids are able to tolerate and few kids are not tolerating. Most of the common symptoms was vomitings. So we see before giving it, and then we use it. So very little data is available on Clostridium butyricum as a probiotic, but we tried. So we are able to see that this is very good, and they were using it for some gastric cancers and Clostridium difficile infection. So it is like by the name of genus we go. And we may think it is pathogenic, but it is not actually pathogenic. And I happen to read some of the articles that Clostridia are the major pioneering microbes. So we just go by the word Clostridium difficile and we just generalize that. But Clostridia are the most, they are pioneering microbes in the gut in the fetal colon, and they do immune priming also. So I've tested my second child for that one. So in the first week itself, he had 18% of Clostridium botulinum, and the autistic child did not have any Clostridium botulinum. She had 0%. So after fecal transplant, it changed a bit. But so I suggest these two probiotics during fecal transplants, or even if somebody doesn't opt for fecal transplant, do a proper bowel cleanse and use these probiotics or some other probiotics if some other practitioners observed betterment. So those probiotics would be good. So, but live bacteria is better than spore probiotics. Maybe because of fillers, or maybe they may not be able to colonize. They may not be able to with probiotics also there is some sort of die-off reaction. But some probiotics are like when we use spore probiotics, it is backfiring. So we must be careful about that. But otherwise, yeah, we can use probiotics.
Thank you.
Thank you. So I'll come back to Dr. Deepak. So, sir, chronic infections are a major play, especially fungus, and die-off reactions is another reality. You know, then a child goes to small-time regression, temporary regression. Parent gets worried. Oh, what is this? This doctor is. So, what is your experience, and how would you tackle these chronic infections, and how would you help them to go through these die-off reactions?
See, there are two things. One, identifying the infections through the symptomatology. So if I know somebody is laughing, self-stimulation, restlessness, with sugar intake, so I know that's something I'm dealing with. I'm dealing with a person who's having yeast or fungal issues. If I know somebody is having, licking, biting, pinching, alteration with the moon cycle, losing, not gaining weight, anal scratching. So I know hyperactivity, teeth grinding. So I know I'm dealing with somebody who's a parasitic. Correct. On the other hand, I know somebody having stimming, visual stimming, especially history of regression, visual stimming, on and off regression happening, repeated infections happening, and along with warts are there, I know somebody I'm dealing with the viral. So in that way, and especially you can't forget Clostridium. Yes, absolutely. If somebody having, and that's one of the things, it's very, very hyperactive and very foul smelling stools. I know that I'm dealing with a person with Clostridium issues. So in that way, because by the time you send a sample, and by the time the sample report comes, it takes time. It takes time. So I have a very strong, the window period is there where by the time the report will come. So on my basis of symptomatology, I tell them, okay, you give the sample tomorrow morning, but after that, this is what I'm suspecting, you started. And sometimes it is difficult to take the samples also. Difficult to take the blood samples, difficult to take the stool samples. It's very tough. It's not easy. So they say, no, we can't get the samples. On my clinical judgment, I start them. And that is what regression happens. If child who gets sensory overloaded along with this, all this symptomatology is happening up, he just stops responding. And a lot of kids, when I put them on antifungal protocols or antiviral protocols or anti-parasite protocols, I see them, they settle down, and again they start working and moving forward. So this is what is there. So different infective protocols are there. These are common ones. But sometimes it can be uncommon ones, or rare ones also could be there, which is usually not picked up. But yes, these are the most common ones, either yeast, either fungal or parasite or Clostridium or your viral ones.
So, sir, how many rounds of treatment, that would need to clean these infections, or what are the sequence that you follow to clean these infections?
Now, if I'm suspecting, like I say, I don't follow one protocol. Let me tell you, that's why all the prescription varies. So I follow as per the client and as per the parent's comfort. So I do very collaborative, and the theme of it of your symposium, of your work, this thing is conference, very, very patient centric. So I do as I talk to them, and I do as per. So I don't follow that in every child I have to follow a viral or a parasite or a yeast. I don't follow that. So after we have worked on, as Dr. Arvind said, the first thing I definitely emphasize on the gut, and then I put them. If I see yeast symptoms, I put on the yeast. If I see parasitic symptoms, I see the parasites or viral. If I see both the symptoms are there, so then I start after the gut thing. I start the parasite one, and then I add the yeast one. The parasites usually I do 3-month protocol. I do 3-month protocol. Usually I do 3-month protocol. There are multiple protocols are there. I do 3-month protocol, three days a week and 2 times a month. That protocol for 6 months, 3 months I do it. Correct. Sometimes I do only 7 days a week around the full moon, three times in a month for 3 months. That protocol I do it depending on that. So that's one protocol. Along with that, if I'm able to achieve that, I stop that and put some natural antiparasites in between. So that can be taken care of. That's one thing. If I'm doing for the fungal protocol might goes on for slightly longer time. I follow it longer, but then depending on the symptomatology severity, for some of them I follow 15 days, once every 3 months, so 15 days every 3 months, or some of them 15 days every month. Or some children who have a very intensive thing, I give them continuously for a few months. I give them, correct? This thing is there. So in that way, I'm able to achieve, but I do give them a break. Some of the children I've seen very good response on the Sporonex. Some papers are there, and I also have seen very good response only on the Sporonex brand of itraconazole. But there you have to go to the higher doses to 400, 500, 600 milligram. But again, that is where the liver can get hit. So you have to be very, very careful. But that's where you see a very fantastic, the antifungal works, very voriconazole or your nystatin, nothing. But then at that time I've seen itraconazole works. So this is the way I chart out for every child. For viral, usually I follow vitamin A protocol. Low dose protocol or the high dose protocol, depending on the parent's comfort. With high dose protocol is 2 days in a month for 3 months at least. Correct. For low dose, I just continue them giving for some time, for a few months. The high dose protocol is something 2 days, 2 lakh units for 2 days each for 3 months minimum. And then if you're seeing, you will see if there's clear cut viral regression, visual staining, definitely you will see that happen. Otherwise, I do get the viral markers done. Usually I get CMV, cytomegalovirus, IgG, and EBV, EB virus, this thing. If the IgG markers are high, one of my colleagues, Anju Usman, who is in Chicago, one of the experts in biomedical. So I learned from her this part, and in those cases, I use your ganciclovir. There I see some response, starting with 250 milligram, gradually building up to 1000 milligram. I'm a big fan of fecal transplant. Let me tell you, I've never done it, but I'm a very big fan of fecal transplant. I've been closely following it from the day it came up. I've read most of the papers, I've followed most of the double-blind studies which has happened across the world. I followed, and I really big fan of fecal transplant because I believe fecal transplant can do a lot of wonders, especially people who have a lot of fecal and a lot of gut issues. So, and I know I've never met him, but I've heard about his Dr. Chandrasekhar's work, but I never knew he's a parent.
I met you, sir. I met you. I came to your clinic with my daughter.
Oh, yeah. I don't remember. I don't remember. I remember Mini, but I don't remember you.
So by then I didn't start my clinical trial. So when Dr. Anju Usman came, I came to your clinic. I met you.
You consulted Dr. Anju Usman. You consulted Dr. Anju Usman, correct?
Yes, you were also there.
Yeah, I was also there. Yeah, I remember.
So that's the world is small, and we all are connected.
Yeah. Absolutely. So these are my different protocols I follow as per them. But I usually make it child. I don't follow one strict protocol. I keep on modifying as per the client, as per the child. Sorry.
So the takeaway message for the parents is, or the clinicians, every child is a different child, and infections can take a longer period of time. And you can see little regression in between. That is temporary. That's a die-off reaction. So you stick to the plan, stick to your doctor. Things will happen. Don't run away from one doctor to another. Everybody knows what they're doing, but initial phases, just to set the context right, it takes time. So please stick to. So I just last question to Mini Dwivedi ji. So how important is mother's own energies and health and anxieties, good or bad, can impact the child? How important the mother has to be grounded for the child to heal. So what is your take on that?
Most important. See, yesterday also I talked about mirror neurons. Mirror neurons works on this principle only, that the person I'm sitting with is highly anxious. The chemical changes starts happening in my brain also. So if mothers are not grounded, the children, they really pick on the anxieties of mother. And because for our children, all the sensory overload comes as a ties to them. and because of all these issues which we are discussing, they are not able to understand whether these difficulties, it belongs to them, these feelings, it belongs to them or it's someone else. And they really think it's theirs. And that's the reason there's a difference between anxiety and anxiety disorder. I have seen anxieties in children like a disorder, always in the anxieties, and then leading to panic attacks. So if mothers remain grounded, it means we are able to slow down. And that slowdown occurs in various ways. How we approach the child and look at the communication of the child, whether the child is avoiding or my child is coming towards me, connection seeker or avoider. So that is very important. Looking at the face. So is he using compensations? Compensations means I'm in my fear paralysis. It means my primitive reflex brainstem has triggered already. Now my cortical regions are not going, I cannot do anything anyways. So the punishment or reward systems are not going to work here anyways. Then my tone of my voice, my own facial expressions, because amygdala is always so on for our children. So these are the things. So it is part of the relationship. It's the piece of the relationship and the trust. So if you are taking your child to a therapist, and if you do not trust that therapist, if you do not trust that doctor, your child is getting a message that no, this is not, my mother is not trusting this person. This is not the person I'm going to respond to, because my body is not going to respond. You have to understand this is so connected, because I read a very interesting book, 7.5 Lessons About the Brain, and she has mentioned, Dr. Lisa Feldman Barrett, that the brain's job is not to think. The brain's job is to manage the body, to keep the energy reserve of the body and use it in a balance. Brain's job is that. Thinking is just a very small part of it. So relationship piece, consciousness piece, being mindful piece, watching your tone, watching your facial expressions, and not overwhelming the children on the top of their already ongoing sensory experiences. It's very important. And when we are able to see that, we see great results in our children. I have seen children, they have changed so much because of the relationship piece. And of course, changes are much more when parents are also on some kind of treatment, biomedical, but it's very difficult to convince parents to go on a gluten-free or a dairy-free diet or do other stuff or to get the testing. That's very difficult. I try my bit, whatever I have learned from all of you, I really try my bit. But this is the piece I can support with. But yes, parents' own anxiety and creating a very nurturing environment in the house is very important. And also one more factor I would like to add here. I'm so sorry if I'm taking extra time. The relationship between parents, that is also very important.
Fantastic. So I think we're just closing the session. So just, some of the questions are asked. So Dr. Chandra, you have to message me the names of the probiotic you mentioned, so we can pass it on to the audience. So if you WhatsApp me the names, kindly don't do it yourself, guys. These are very, very specific, strain-specific probiotics which have positive and now. So a practitioner should choose. Okay. So just a last concluding remark, Dr. Deepak, what would your final remark on this?
Only few lines. Start early, act fast, and work as a whole team. Correct? When you work as a whole team, and when you work as a whole, addressing the gut also, addressing the nutritional deficiencies also, addressing the inflammation also, oxidative stress also, heavy metals also, methylation, which is one of my favorites, and I do MB12 injections. That's I didn't get a chance to share about that. So work as a lot of brain inflammation, I use hyperbaric oxygen therapies. So in that way, work as a whole. Don't think only one thing will fix a puzzle. A lot of times you have to hit at multiple targets. So once gut is fine, you need to add other things, as Dr. Arvind said, one layer after one layer. And then you see the things start. And the last important point, enjoy every accomplishment. Enjoy those trophies which you will get, because you can't get 100% success. So when you get 5% success, enjoy that, then 10%, then 20, and gradually you will move up on the success ladder. Thank you very much.
Fantastic, sir. Thank you. Thank you so much, all the esteemed panelists. Thank you so much. Over to you, Ruhi.
Thank you. That was a very interesting and insightful session. So even 1.5 hour of panelist discussion also seemed to be very short. We still have so many questions in the Q&A to be answered. So, so for the audience out here, we will address all your queries. If not here, it will be addressed over WhatsApp, or, we'll take it through one of our sessions as we, finish one session after the other today and tomorrow. But I'm sure all the audience out here, you now have a very different perspective towards autism. We had panelists speaking about fecal transplant, about co-regulation, about nutrition, about very holistic support towards treating autism. And they were, our panelists had their own journeys with autism. So I'm sure this was a very insightful session for all of you.